Hello out there in television land, and welcome to yet another edition of It's Your Health. I'm here with my bride, KB, and we're ready and willing to give you...
I don't know if we're ready.
What's wrong, sweetheart?
Well, you're not wearing a shirt. Don't you at least wear a nice shirt we're on television, for heaven's sakes?
Sweetheart, I haven't gotten to the wash yet. Give me a break, okay? Give me a break.
What wash? You don't do any wash in our house.
That's the problem. She doesn't know where the wash is.
He doesn't know where the hamper is for the wash. That's his problem.
Yes, indeed. I've never met a man with so many faults.
That's true.
That is true.
Neither have I.
Listen, make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Right, sweetheart?
Absolutely.
All right. We'll be back after this brief commercial message. Remember, you're listening to It's Your Health, your leader in healthcare information.
And they're watching it, too.
Oh. Get a load of that slide. Isn't that amazing?
That's awful.
That COVID is like the #1 killer.
By a lot.
By a lot. But listen, just to patch up about the wash business, let me see if I can make it up to you. Now listen to this very carefully. To be happy with a man, you must understand him a lot and love him a little.
I love you a lot.
To be happy with a woman, you must love her a lot.
Yep.
And try not to understand her at all.
That's very good advice.
Okay.
You should hang that on your wall.
That's where I got it.
Well, that's where you should put it back.
All right, let's go with our headline, sweetheart.
Okay, our first headline is on compression stockings for preventing deep vein thrombosis in airline passengers. Compression stockings are effective at reduced DVT in airline passengers taking flights longer than 5 hours.
Well, that's with any type of situation where you're sitting for like 5 hours. You can get swelling and edema of the lower extremities resulting in a DVT, which means a deep vein thrombosis, which is a blood clot. I generally, when I'm flying, try to get up and walk around every hour.
When do you fly?
When I usually drive, I usually get out of the car after an hour.
Well, that's more believable.
And walk around. But they are saying that if you wear compression stockings, your risk of a blood clot is lessened. So.
And that's something to keep in mind for everything. Here's one I like. Walking 7,000, not 10,000, 7,000 steps per day may slash your death risk by 70%. For middle-aged individuals like me, walking at least 7,000 steps per day may reduce mortality risk up to 70%. Based on data that they have accumulated. This is important. Those who took 7,000 to 9,000 steps per day had a 72% reduced chance of mortality. And those who did not do it showed no benefit and 55% chance of something going wrong. So
yeah, you don't use it, you lose it. And of course, people are now having these watches, what are they called?
That's what I want. I want one of those watches.
You have to tell me where to order it or get it. I'm not sure. But is it a Fitbit? Is that what it is?
No, I don't want a Fitbit. I want an Apple Watch.
All right. In either event, they have mechanisms for you to decide how far you've walked that day. So 7,000 steps may not be out of the question.
Well, you know, I do that with my phone. I put my phone in my pocket when I walk the dog. And yesterday, because of this, I took a longer walk and I got in 5,500 steps in one walk.
So I'm stuck with you, huh? All right. Moving right along.
So
Next
it
headline.
might mean something good.
Okay. All righty.
Okay, seriously now. Diabetes Prevention Program. 1 of 3 American adults has pre-diabetes. Lifestyle changes are more effective than medicine or a placebo at reducing the risk of progression to diabetes.
It is an epidemic, no question. 1 out of 3. Think about that. 1 out of 3 out there in television land, in the sound of our voice, it has pre-diabetes, which is going to, if not treated, go on to diabetes. Some of the risk factors, of course, are whether it runs in your family. And one of the major risk factors, of course, is gaining weight. And everyone has gained what I call the COVID-15, 15 pounds since COVID had started. And of course, winter doesn't help around here as well. So it truly is an epidemic. Now, how do you diagnose prediabetes? It's pretty simple. You get a blood test called a hemoglobin A1C. And that is like if I pricked your finger every hour for 3 months and measured your blood sugar, because the life of a red cell is 3 months, and the sugar gets stuck inside the red cell. So if you are interested in making sure you do or do not have prediabetes, then get the hemoglobin A1C. No great treatment for it except reverse the things that got you there. Of course, you can't change your parents, but you can change what you're taking in terms of carbohydrates, weight, diet, and exercise. It's going to be a recurrent theme you're going to hear today.
Healthful diet, physical activity, stop smoking, control your blood pressure. All of those things matter.
Right. Well, again, when you have diabetes, you're going to put yourself at risk for a lot of bad things, heart disease, stroke, peripheral vascular disease. And so controlling your blood pressure along with cholesterol and getting rid of those bad habits will go a long way.
Okay. Is there anything that you wanted to add to any of this that I have here?
I just think we're in a heap of trouble because the country is just getting wider. I blame the pasta and breads, and it turns out there are some people who are very carbohydrate sensitive. For example, if we have stromboli or pizza over the weekend, I'll have gained a pound or 2. So the opposite also happens, and that is to say, if you are very religious about it and eliminate things like pasta and bread, which are comfort foods, you can you can lose 2 pounds a month doing nothing else. Can you believe that?
Can still eat everything else?
Everything else, get rid of the pasta and get rid of the breads.
That's a hard thing to do. That's a mainstay for a lot of people.
It is a hard thing. They're comfort foods. I had a couple patients who really took me up on this. They stopped bread and pasta, and they kind of went into a little withdrawal, believe it or not. They missed it.
Okay, well, let's not talk about that anymore, at least for the moment. Let's talk about something I had never heard of, transient global amnesia. It's a clinical syndrome characterized by amnesia and confusion for up to 24 hours. They don't even remember what happened that day.
Yeah, you'd think they had a stroke, and of course that's first thing you'd want to rule out is a stroke. Or some type of other problem that could have affected your mentation. But it is a real entity, transient global amnesia. It may happen out of stress, believe it or not, or physical activities. And usually when the dust settles down, it turns out to be a diagnosis of exclusion. In other words, we didn't find anything else wrong out with you. And it may never happen again.
And very quickly, because we're almost out of time, tell us about vitamin A, but make it quick.
We will make it quick. Vitamin A, along with D, E, and K, of course, are fat-soluble vitamins. People are on supplements for vitamin A. They accumulate in your body and can lead to toxicities and problems with your calcium levels. So make sure that if you are taking supplements, you bring it to the attention of us so we can measure these things in the blood. Because some patients don't consider supplements medications. And I had one patient just recently whose liver tests and this and that was all off the charts. It turned out they were taking supplements that were fat soluble and kind of messing up with their organs. So
they tell us now when we fill out our form, what medicines are you on, to include anything you are taking. And I just like to mention that the A chronic amount of vitamin A is increased bone resorption, reduced bone formation, hypercalcemia, and increased risk of fractures. And on that, we're going out with this slide. The poor guy just got robbed at a grocery store. He was at the gas station.
Right. We'll be right back after this brief commercial message. You're watching It's Your Health. Welcome back to the second segment of It's Your Health. I'm here with my bride. And it is sad but true, but in order to connect the dots and try to get access to healthcare these days, as that cartoon implies, it takes a lot.
It's not easy, and everything is, no matter where you call, it's press 1, press 2, press 3. You don't get to talk to anybody.
No, it's sort of the sign of the times. And I'm an old school guy. I really kind of just liked when people answered the phone and said hello.
Yep. So let's see what we've got here. I have questions for you. Those are going to be our headlines.
Oh, really? Okay.
Mm-hmm. Are positional therapies, explain that, effective for treating obstructive sleep apnea?
Good question. That's another sleeper diagnosis out there, no pun intended. But obstructive sleep apnea is really underdiagnosed and obviously untreated because a patient does not come in and say, I think I have sleep apnea, because they're sleeping. Of course, one of the hallmarks is snoring or someone observing you stop breathing for a couple of seconds, something like that. Well, anyway, what happens is the tongue will slide back and partially obstruct the thing that hangs down the back of your throat, hence you snore. But the oxygen levels fall, which can affect your organs, brain, heart, everything else, because we live on oxygen. And so if you're lying back and you're heavy chested or obese, which is another common denominator of obstructive sleep apnea, you're going to make yourself worse by lying on your back as opposed to a side sleeper. If you're out there in television land, measure your neck, and if it's 17 inches or bigger, there's a good chance you have obstructive sleep apnea. One of the good news is they're now doing home sleep studies, so you don't have to go to a sleep lab to get diagnosed.
Okay, so you might need somebody to diagnose you at home first.
Yes.
And tell you.
That's why when I have a husband and wife team in, I turn to the wife and say, what's he not telling me?
He's not talking?
Well, no, he doesn't tell me a lot. Guys kind of hold things back.
And the women don't?
No, the women are always kind of ratting out the guys.
I think we're all going to remember that.
Okay.
Let's go to the second thing. In patients requiring mobility assistive devices, when would it be appropriate to prescribe a cane versus a walker?
Pretty simple. If you have use of one good arm, then you would use a cane. If for whatever reason your two arms are not 100%, then you would use a walker.
Or legs.
Sure, absolutely.
Okay. And the last one. Does lung cancer screening with low-dose computed tomography, I don't know what that is, decrease mortality in smokers?
Yes. Most recently we have instituted lung screening for lung cancer. Usually a chest x-ray will not do it. You would need to have a low-dose CAT scan. There's no dye involved. And insurances universally pay for this, at least that's been our experience. You have to have had a number of pack years in order to be eligible. A pack year is, say I smoked a pack of cigarettes daily for 20 years, that's 20 pack years. And the more pack years you have, the more eligible you are for this CAT scan. And I just picked up a patient, believe it or not, chest x-ray is normal. CAT scan, because he's a longtime smoker, shows a nodule in his lung. And hopefully we'll be able to get rid of it because it's an early stage, and that's the name of the game.
Yeah, you know, it's amazing how things change. Like when I got hurt, I had an x-ray and it was normal. And then the doctor sent me back for an MRI, which showed it wasn't normal.
Right. You had a fracture. So,
Yeah, so it all depends on what kind of test you're getting, I guess. Okay, screening for prediabetes. Tell us here, I will give this to you and you can answer those questions.
Okay, we talked about diabetes earlier, and of course we'd like to catch you when you're a pre-diabetic. So if you are overweight and if you're over 35, chances are you are going to screen positive for pre-diabetes. Again, that's 1 in 3 out there. The other thing is that if things run in your family, again, there's a good chance that you're aging, you start expressing the genes that your parents gave you. I always say you need to pick good parents.
Oh, darn it.
And that can also be sort of a hallmark for pre-diabetes. And usually we would start with diet and weight loss because I don't want to be putting people on pills. Some people are put on metformin, for example, but it really is up to you to reverse what got you there. So that's usually what we would recommend.
And that's hard. That's hard to do. It's much easier to take a pill than it is to try to reverse the habits that you have.
No doubt.
Okay. Can walking, we're back here, lower blood pressure in patients with hypertension? Hypertension can contribute to heart disease and is affected by an individual's physical activity level and lifestyle habits. Walking can be a relatively easy and affordable way to incorporate lifestyle changes.
Yes, no doubt. Again, we've lost that ability to walk around. And the other major thing, of course, is salt intake. There's a lot of hidden salt in
Everything.
all processed food. So you really got to throw away the salt shaker and monitor your blood pressure because it's a silent killer. You don't even know you have it.
And they recommend walking 3 to 5 days a week at a moderate level for 20 to 40 minutes. That's all it takes.
Yo, that's longer than we walk the dog.
The dog likes going for walks. Cold or allergy? Which is it?
Right, well, we get calls all the time saying, I have a cold, I have a sinus infection, or is it allergies? Well, time out. It's COVID till proven otherwise. You come down with sinus issues, you need to get home tested for COVID-19. And the home tests, unfortunately, are not reliable because people may just swab the front of their nose. You really got to go back and make tears and get a good sample. But in either event, let's look at this slide and go through some of these symptoms. If you have a cough, it's usually going to be a cold. If you have aches and pains, it's usually going to be a cold. If you have itchy eyes, that's going to be an allergy. If you're, for example, sneezing and having a runny nose, that both could be allergy. Sore throat is usually a cold or an infection. And fever, of course, would not be associated with an allergy. So kind of just follow that chart that you have in front of you, and we can wrap it up on that one. What do you think?
Well, we'll wrap it up with what a CAT scan really looks like.
Oh, there you go.
We'll be right back for part 3. Oh, I just love that little cartoon that was right there. And my dog does follow me to the bath every time I go. And he sits there and waits for me to be finished. You know why, I figure?
No.
I figure it's because we do that for dogs. We watch them go to the bathroom. So maybe they feel they have to do it for us.
Okay, well, he's not holding an empty bag, gonna clean things up after you, right?
Right. That's
Okay.
not his job. Okay, let's get serious here. Should routine screening for colorectal cancer start at 45 years of age? Colorectal cancer is the 3rd leading cause of cancer-related death in both men and women, behind lung and breast cancer. And it's second only to lung cancer when men and women are combined in the study.
Controversial. When we were, of course, learning medicine, we said, well, wait till age 50 and then get your colonoscopy. However, that age is being lowered to age 45. There are some studies that say, well, it's of benefit, especially if it runs in your family, and especially if there's a history of polyps in your family. So I think the age for colonoscopy is going to be lowered and lowered. I'm not sure it's drifted into the insurance realm. I once sent someone to even get Cologuard testing, and they said, well, they're not 50 yet. But I think that's part of the problem, is you can't have a situation that's insurance driven. It has to be patient care driven.
Speaking of that, what's that called?
Cologuard.
Cologuard. I had that and I failed. So I ended up with a colonoscopy. It says here that the leading cause of cancer-relating deaths by 2030 in younger individuals is going to be, guess what?
We're back to colon cancer
We're
again?
back to colon cancer.
Right. It is.
Younger than age 50.
It's, again, one of the top three cancers to look out. Easily screenable. And again, we want to get you at an early stage. One comment about the Cologuard testing, although it's convenient because they mail you a box and you do your duty in the box and send it back.
But it's still not fun.
It will not pick up a polyp that is destined to become cancer because that's what a colonoscopy would do.
Oh.
So again, the colonoscopy is going to be the gold standard. But the Cologuard's better than nothing, but may not be entirely reliable.
Not bet my money on it, huh? Okay. Speaking of DNA testing or Cologuard, it was approved. And what do you think about that?
One of the things that has happened is at least the Cologuard testing now is getting almost universal insurance coverage. Initially it wasn't.
Oh boy.
But I guess insurance companies looked and said, look, a Cologuard test, which might run a couple $100, is better than a colonoscopy, which could be a couple of thousand. So we'll at least pay for that.
Yeah, they mail it to you and everything.
Right. So, I mean, it's better than nothing. But again, if you're at high risk, I would go with the colonoscopy.
And guess what we're back to? Food.
Oh, there we go.
The relationship between food and disease. About 57% of calories we consume every day in this country are ultra-processed foods, such as soft drinks, hot dogs, cold cuts, fast food, packaged snacks, cookies, baked beans, fruit yogurt, packaged bread, ready-made pasta sauces, and breakfast cereals. That sounds like everything, but what happens is all of that bothers our tissues. It bothers our heart, our arteries, our brain, our pancreas, our liver, and our lungs, and it leads to disease, including possible Alzheimer's.
Yeah, I think that if you go back to when we first became humans, if you will, we were hunters and gatherers. There was absolutely nothing that was processed, period, end of statement. And today, everything is processed. Mm-hmm. And so we really got to get back to fruits and veggies and things that we don't kind of start fooling around with. I think the theory is that these foods that are processed are inflammatory. And if you thought of your body as a nuclear power plant, a lot of diseases are inflamed related. Inflamed arteries lead to coronary disease, inflamed arteries lead to strokes, and inflamed tissues can lead to cancers. And so probably a lot of the ills that we're having today are a result of these processed foods. So again, that's why I take fish oils, because the fish oils are high in omega-3 and they are anti-inflammatory, whereas our processed foods are omega-6s, which are very pro-inflammatory. So the last thing your body wants is inflammation. So it's hard to, but I think you got to get back to more natural, unprocessed foods.
Why am I not taking omega-3?
I don't know. It's on our counter.
Well, you never mentioned it to me.
Well, the way I cook for you, sweetheart, you don't need it. All right. So you just
Okay.
you get all the good stuff.
I know. You take such good care of me. I want to ask you a question about something I don't know about long haul COVID-19?
Oh, that's something you don't want to know about. And of course, this novel COVID-19 infection, we're still writing the book about it. And there are a group of patients who survive the initial illness, but they become COVID long haulers, and it can affect any organ. Most commonly, we see people who have persistent cough, there's shortness of breath because it affects the respiratory tree. Some people get brain fog and have difficulty remembering things, or
Loss of taste and smell.
Exactly. Keep in mind the virus enters through the sinuses, so of course those areas will be affected as well. So unfortunately, I don't have a great deal of care and treatment for the COVID long haulers, except to eliminate any other secondary condition. And for that, you'd have to see your physician and make sure that you are not blaming everything on COVID long hauler syndrome.
But you should check, because one of the symptoms is short of breath, and somebody could feel short of breath and think nothing of it, when in reality it's something to consider. So that's about it, unless you want to do another one.
Sure, I'm always willing to do another one with you.
Screening tests for women.
Okay.
What kind of tests do women need?
Well, they need mammograms. They need colonoscopies.
Mammograms don't hurt, by the way.
And they need to get up-to-date GYN care because they're women, and they need to be examined for women's diseases. Am I leaving anything out?
Just colorectal cancer.
Yeah, that's
Part of the things that you have to get done.
Part of the standard. And you know, people take better care of their cars. Your car has to get inspected once a year, and we have people out there that don't even do that for themselves, which makes us sad.
Yes.
And it makes
as we close,
it makes us sad to say
this should make you happy. Read what this says. If you can find a woman who will watch an entire football game with you following Notre Dame, you should marry her.
Oh, well, that's going to take a lot of alcohol, but if you say so, okay. All right.
Oh.
Thanks for watching and listening to our It's Your Health, leader in healthcare information. It's been our pleasure to inform and
It is our
entertain
pleasure,
you.
yes.
And enjoy the rest of spring and summer.
Absolutely. Thank you, Sammy.